talking to a therapist, they have a way of making everything within like an arm's reach. Like you feel like everything is like a sense of everything's going to be okay.
Totally true.
It's totally true.
Totally,
like,
it's a weird thing.
It's almost like they say it and they go, well, when you say it like that, it's not so bad. And like I kind of look at myself like, why couldn't I just get that through my head?
Because you're talking to you. You
right.
only know
you're your own worst enemy.
Yeah, and you only know your situation.
Right.
So your narrative comes from your experience, but this psychologist is saying, hold on, take a step to the side.
Right.
Now look at it.
What if you look at it like this?
Yeah.
That was NBA All-Stars Kevin Love and Channing Frye talking about what a difference therapy has made for their well-being. And joining us now to talk more about the importance of mental health treatment is Dr. Jeffrey Lieberman, professor and chairman of psychiatry at Columbia University. Dr. Lieberman, thank you for joining us on We Need to Talk.
Thanks. My pleasure to be here.
We really want to kind of delve into your expertise on this, specifically about various disorders and things that you're seeing athletes come out with. And we have our resident athletes right here, Katrina and Darren. You know them well.
Yeah, Dr. Lieberman, I was wondering, you have an athlete that trains their whole entire life for a goal, an event, a medal, whatever it is. They don't reach that goal. They become depressed because they have no idea what to do with their life after that. How do you differentiate between an athlete dealing with depression because of that and an athlete who actually has a mental illness?
That's an important question because the terminology that's used to describe mental illnesses oftentimes overlap with, our vocabulary for describing normal reactions and emotions. So, if you have a broken bone, there's nothing normatively that occurs if you have high blood pressure. But if you're depressed, oh yeah, I get depressed. I get nervous. I get nervous too. So the terminology is confusing to people. Also, in the course of your activities, particularly if you're in a competitive situation, there's going to be ups and downs emotionally. But the brain is built to be resilient. Just like when you exercise intensely, you need a period of recovery. So something bad happens, whether it's a fight with your spouse or whether it's you lose a race, and you're down and dejected for a period of time, that would be normative, but you should be able to bounce back. It's when the intensity of the adverse emotion exceeds the proportion of the disappointment or persists for too long, or it becomes disabling to the point that you're not able to do things and you're staying in bed, you're not eating, you're not taking care of hygiene, you can't get to work. And that's a sign that it's gone beyond that and it's possibly due to an illness or really such an extreme reaction that you need help.
Yeah, but when you're an athlete, you're taught to be confident, strong, and unbreakable. How do you get athletes to address their vulnerability of weakness and showing that there's depression or mental illness?
That's the million-dollar question. You hit the nail on the head. So military ethos and competitive athletics ethos are similar in that you are encouraged and trained to develop this like supernormal level of confidence and capacity so that you're invulnerable. You can overcome anything. No challenge is too great. I may be dying and my muscles are hurting and so forth, but I'm going to push on and win. So that's the idea of acknowledging psychological weakness is antithetical to that. And that's why the military has had such a hard time with dealing with military mental health issues, PTSD, suicide, and so forth. The same thing with athletics. It's like, we don't want to talk about it. But you cannot suggest somebody to have a mental illness. It's like when somebody feels suicidal, everybody tiptoes around and says, oh, I'm not going to ask him about that because I don't want him to think about it. It's the opposite. You diffuse, just like Kevin Love said before, once you have opened up that issue, it's a relief. So there has to be an extra effort made to enable athletes to be conversant with what may be a problem for them in terms of reacting to competitive activities, and when and how to come forward and request help.
Well, when you talk about that, about coming forward and talking about it, as we see more public figures, Kevin Love, Brian Dawkins, Brandon Marshall, talk so openly about their own experiences, do you feel like that is a catalyst in any way? Is that changing the stigma associated with mental health, mental illness?
It's definitely good. But I would venture to say that they are the tip of the iceberg. In other words, they represent a very, very small proportion of the total number of individuals who are actually affected and don't come forward. It's courageous of them to do so, and I hope it results in them getting them the help they need. At the same time, they do so at their own peril, because I have no idea whether the stigma associated with mental illness will affect their careers adversely. I mean, not their ability to play, but how they're perceived, sponsorships, the team they're playing on want to re-sign them or something. But hats off to them for being leaders in this area. I mean,
Moving forward now, what do leagues have to do to help their athletes? What's the need to have more education for general managers so that they can sign players that might be diagnosed and they're not turned away?
I think you have to take like a profession or a field-wide view of this and determine what the policy should be. So it can be top-down or bottom-up. A proactive, enlightened team can do it for themselves, or a league can do it. But in either case, the organization would be well advised to recognize that their workforce, their athletes, preserving and maintaining and optimizing their health, because it's absenteeism, but it's presenteeism also. They won't perform as well if they're affected, and just by their sheer, grit and gumption, they just are, trudging on. That they attend to this. So, if you sprain your ankle or you have chest pain, you know who to see. If you have these mental signs, do you go to a therapist? Do you go to your clergyman? Do you go to a new age therapist? Do you go to a sports psychologist? Do you go to a psychiatrist?
So the leagues need to, and these teams need to have them readily available. Well, clearly, Dr. Lieberman, there's a lot of work that needs to be done in sports, and we thank you so much for your time to share a lot of your information with us today. And